Good morning, everyone, and welcome to the Center for Family Justice Legislative Event. Thank you so much for attending this morning to learn more about the public policy initiatives around domestic and sexual violence in the state of Connecticut. Happy New Year to everyone. We were hoping to have this event live, as you know, but unfortunately with the current situation around public health, we decided to go virtual again this year, but we have our incredible presenters from our coalition this morning who will be here to share the policy priorities for the upcoming session. And I know it's going to be a great event, even though we can't all be together. Just a few housekeeping things that I wanted to go over. There is at the top of your screen a section that says handouts. In that section, you can find documents from both the Connecticut Coalition Against Domestic Violence and the Coalition to End Sexual Violence, outlining those public policy priorities for this session. So don't feel you have to spend the whole time on the webinar this morning writing everything down. You can upload those documents and have them for your review later in the at a later time. Also, we have the questions section in the comments. So please, if you have any questions throughout the course of our presentation this morning, we will be monitoring the chat section and we will lob those questions out to our presenters so that they can answer them for you. So as you all know, the Center for Family Justice is the provider of services for victims and survivors of domestic violence, sexual violence, and child abuse in the greater Bridgeport area. We are a member of the Connecticut Coalition Against Domestic Violence and the Connecticut Alliance to End Sexual Violence. And we are very, very proud to serve the victims and survivors in our community. As a family justice center, we're very proud to provide wraparound services to our clients to ensure that they not only have what they need while they're in crisis, but that once they are past the crisis, we are helping them to create safer, healthier, self-sufficient lives for themselves and their families. So we are going to start our presentation this morning with the new CEO and president of the Connecticut Coalition Against Domestic Violence, Megan Scanlon. So Megan, please, will you introduce yourself a little bit and talk about the policy priorities for domestic violence for this upcoming session?
Sure. Thank you so much, Angela, and thank you to all of you for attending and taking the time out of your busy schedules to listen to what we have to say on behalf of victims and survivors. And I certainly want to thank the Center for Family Justice and Deb. I know she's out there somewhere. She'll join us later, and the rest of the staff for putting this together because it's no small feat, especially pivoting from in person to virtual in this crazy time. So. With that, I'll tell you, I've been 6 months into this role, and it's been, I'm sure, as you know, challenging for all kinds of different individuals impacted by the pandemic. But something that you probably already know, but if you don't, is that victims of domestic violence have been hit really hard by this pandemic in terms of layering essentially a public health crisis over another public health crisis. So across the state, we've seen our shelters way over capacity. We usually run about 120 to 140% over capacity. I think at the highest in the pandemic, we were at 180 in terms of capacity for shelter. We are not turning anybody away, so we figure out hoteling, we figure out other alternatives to sheltering if we don't have enough beds at that time. And we know that that's going to be a trend that continues well beyond the pandemic. Other issues that we've been seeing are just the complexity of the cases are much more complicated. Individuals and families are coming to us with a lot of different issues all at once. So they have the domestic violence, but they're also dealing with trying to navigate basic needs, trying to navigate childcare, trying to navigate either loss of hours at employment or loss of a job and regaining employment. So we're really providing not just the domestic violence advocacy and the safety planning that you've sort of come accustomed to knowing us for, but we're providing as Angela said, wraparound services across the state when it comes to the advocates working on the ground. And we're really proud of that. We've also seen, courts. We've made a lot of progress with the courts in terms of being able to, file restraining orders, temporary restraining orders virtually. When the governor signed that order, when the pandemic hit, that was great. We were able to really make a lot of progress with that. But we also are seeing a little bit of a delay in terms of some of the court cases when it comes to divorce and custody. So we are seeing some challenges for some of our victims long-term in terms of the court system that we hope are going to be getting better as courts open up more and more. So we've been trying to navigate that, as well as obviously just this past week, I think we had 24 advocates that were working in the court system, but then came down with COVID. So we've been navigating some staffing issues as well due to the pandemic, especially due to this last round. So with all that said, I came into this role, and one of the first people I met with had told me that it was the worst time to come into this role because we, although we are doing more and more work and the increase for services is certainly out there, we are facing a really significant temporary federal cut in funding from the Victims of Crime Act, which is the first thing I want to talk to you about. So the Victims of Crime Act bill is a bill that it's a federal funding stream that typically is funded through prosecutorial restitution when it comes to restitution that's paid for mostly white collar crimes or other crimes that would go into this Victims of Crime Act fund. Under the last administration, for a variety of reasons, some of that restitution got deferred to the general treasury. And Congress passed a fix in July that the president signed into law that would fix that problem over the next 2 years. But for the next 2 fiscal years coming up, 23 and 24, this is a nationwide issue that is impacting Connecticut as well. We will see upwards of a 40% cut to our funding. And so this isn't new. It's not unique to Connecticut. It's all over the country. But it's something that that would be devastating in terms of the services we provide. So I just talked about the court advocates. It's one of our biggest funding streams for the court advocates across the state. It completely funds our statewide domestic violence hotline. So in terms of access to services, it would be a huge loss to victims and survivors out there that are trying to find an access point to services. We've been working with the Alliance as well on this issue and several other organizations to try to fix this. So we are asking, we've been working with the governor's office as well. So we are asking the legislature to look to, for at least CCADV's end, to fund approximately $7 million over 2 years of a one-time temporary fix. So that would be about $3.5 million each year over the next 2 fiscal years. So that's the first thing, and I'm happy to answer any questions that might pop up about that later. And then the second thing that that we've really seen actually before the pandemic and then was exacerbated by the pandemic was our response to children. We know that we want to invest more in our child advocates that are across the state. They serve children that have been impacted either directly or indirectly by domestic violence. And they're crucial, I think, to how we move forward and how we solve this problem generationally and how we make a significant impact on reducing family violence across the state of Connecticut. I know this is something that I think I share a passion along with Beth on, is in terms of focusing on children. So I'm very excited to be working with her and the Alliance moving forward, because it is a similar shared passion of ours in terms of what we want to do. So what we are asking the state for is an annual funding stream state line item that would fund 18 full-time child advocates across the state in order to provide services to the child and non-offending parent. What that looks like across the state is one child advocate at each of our 18 sites. And that's significant because right now we have no money that goes toward this position. Most of our sites cobble together money or combined positions, and that's just not fair to the children that we're serving. Over this last year, we had 11 homicides. Half of them were witnessed by children, mostly under the age of 6, and half of those homicides were by firearm. So for me, there's no choice but to do better for our kids that have been impacted by this issue, and to make sure that we're a better, stronger partner for our partners like the Alliance and others in the community, so that we can make sure that these events are not defining the lives of our children. And then lastly, two other initiatives that you'll hear us talk about over the course of the next several months are housing, especially in Fairfield County. We are looking to sort of flip the script on victims always having to leave their living situation. So we are looking and exploring lease bifurcation for victims when it makes sense in a situation. We've been struggling to find affordable housing in Fairfield County. We've had to relocate a lot of individuals through our rapid rehousing program outside of the communities that they would prefer to be living in and outside of those community supports that they have. And I know specifically for the greater Bridgeport area, this has been a struggle when it comes to our programs for housing and rapid rehousing. So we're looking at that. And lastly, we would like to, very similar to the sexual harassment training that you implemented, we would like to explore a domestic violence training for all state agency employees. And that's all I have. I know it's a lot, and so I'm certainly happy to answer questions later in the program or connect individually with any of you after this as well. So thank you.
Thank you so much, Megan, for your presentation this morning and educating us on the priorities for domestic violence this year. I do want to welcome Deborah Greenwood, our CEO and president of the Center for Family Justice. She is now on the call. Deb, would you like to say a few words before we jump into our next presentation?
Yes, just welcome to everyone. In the world of this pandemic, tech problems, a big shout out. Thank you, Paul Santos, for making this finally happen. As I got on, I got knocked out, and we don't know why, but he fixed it all. So welcome to everyone. Please know that we appreciate all the work that's being done by our two state coalitions as a member agency of both the Connecticut Alliance and Sexual Violence and the Connecticut Coalition Against Domestic Violence. Listening to today's legislative breakfast, we are recording it for those that could not join us this morning, and we'll be doing a lot of follow-up, not just from today, but straight through the entire session and after, as we do before. So thank you, Megan, for your words. I was able to finally get somewhere in between, though. Certainly, we're very familiar here at the Center for Family Justice on the work that's being done across the state of Connecticut. So thank you. Now I'll turn it back to you, Angela.
Thank you, Deb. So our next presenter this morning is Lucy Nolan. She is the Public Policy Director at the Connecticut Alliance to End Sexual Violence. So Lucy, the floor is yours.
Thank you. Good morning, everyone. As Angela said, I'm the Director of Policy and Public Relations at the Connecticut Alliance. And just want to shout out to the Center for Family Justice for, this is always sort of the kickoff event for the legislative session. We always, this morning, our morning get together to talk about the issues. So I really appreciate it every year. And thank you for having us here. I too wanted to go through a little bit. Well, I'll go through the issues that we're working on, but I have to agree with what Megan said, is that we've also seen an increase, particularly in disclosures of child sexual abuse during COVID. And so it's a really, it's a critical time that we all are here. And again, basic needs as well. We are really connecting people more to basic needs than I think we have in the past. And I know CFJ has a great way of sort of putting everything together and making sure that people have access to what they need in one place. And so that's very helpful. But we also, everyone, we have to go where people are as well. So there's a lot of work that's getting done right now that in many ways wasn't getting done, but it wasn't as needed. But so that leads me to the VOCA funding, which Megan explained, and we've been working, what great partners, I have to say, the CCADB has been on this. For the Alliance, we need $3.5 million over 2 years. So that's a significant loss when you think about, I mean, really, $3.5 million would be very harmful with these, especially with the need that we have currently. So we are working on that and working with the other organizations, and specifically with CCADB and Megan. So thank you for all that work. And so our legislative agenda this year is very survivor-led. It's very interesting. Two of the issues are particularly issues that I've been working with survivor groups on, and they have really been in pushing that. And one is to eliminate or to create a window for people who have been sexually abused as children for civil statute of limitations. In 2019, the law was changed to extend the time when people could sue to age 51, and the average age is 52 for people to disclose child sexual assault. However, that only would go into effect if the assault happened after October 1st, 2019. So there are a number of people who have been left behind and not being able to find some kind of closure, healing, getting funds for the amount of mental health issues that they've had. Many survivors, not all, but many end up having some kind of substance abuse problem. So those are things that people have been paying, or the state has been paying out of pocket. And so this is one way to recoup the money, which is not significant. It's about $160,000 per survivor. So we're not talking about millions of dollars, but for many, it is just the fact that they want to be able to talk about what happened and get the predators off the street. And this is one way they can do it, by bringing these cases forward. So all states in New England and New York have either a window or a longer time frame. And so we would like to boost ourselves back up to where we were, because Connecticut was one of the leaders. And so we're working on that. The other is called intimate exams. This is something that when medical schools will use women or men who are going under some kind of surgery or something without their knowledge, to teach how to do a pelvic or a prostate exam. And it's a very sort of broad, informed consent that says that a student might help on during the surgery or whatever. What we're asking for is an explicit consent that if the school would like to offer this time, for a student, that they just get explicit consent from the patient that says, yes, the student can do this exam. Studies have shown that up to 75 to 90% of people will say yes, that they will allow this to happen. And what part of the problem for the medical students is, for many, it's a moral issue. They know they're doing it without permission, but they sort of feel that they have to, because the doctors who are there are the ones who are moving them along on their career. So really, it's just a simple, explicit consent saying, yes, my body can be used for medical training, as opposed to bodies being used for medical training without permission. So that's a second one. And then one of, I think, our biggest piece is we're asking to codify consent in the statutes. Right now, their consent is referred to in the statutes, but there is no definition of what consent for sexual activity would be. And so what we have, the language we're using, language just, it's really, it's unambiguous, informed, voluntary manifestation of agreement is freely given by each individual, and it's without use of fraud or coercion, and also can be taken away at any time. And in showing that if somebody has participated in sexual activity with another, that doesn't necessarily convey consent for the next time. And one of the reasons we're wanting to, what we want to do this is that Connecticut right now looks at the reasonable person, looks to say, well, did it seem like a consent to the reasonable person? And as we all know, different people have different ideas of what is reasonable. In fact, the judge in the Weinstein case said, well, we all know what it looks like, what consent looks like. And obviously we don't, because we wouldn't be going to court if we all knew what consent looked like. And so what this does, and also because of not having a definition in consent, there's a couple times when if there's a misrepresentation of one person impersonating to be, to say, a boyfriend of someone who is asleep, the roommate comes in and gets into bed pretending to be the boyfriend, and they have sex, it's considered consensual, even though it wasn't with the person with whom the victim thought it was. So that would help this because they had sex consensually, but they didn't realize that it wasn't that person. And then also it helps with something called stealthing, which is when a male removes the condom during sex when it's not known. And so it's a thing. And there is no way, there's nothing in our statutes that really will protect people from that, from going in expecting that there is birth control or condom being used and then it's removed during the act without that person. The consent is given provided that the condom is used and then the condom is taken off, excuse me, and then there's a fraud is in there. But so that would take care of a couple of those pieces. And those are things that we have actually seen in Connecticut, surprisingly. And it would also allow when somebody reports, what we hope is that when somebody reports a crime where they felt that they had not given consent, that just signing an affidavit is enough for the police to say, okay, here's one of the things that happened that we're going to look into to investigate the assault. It does not change the burden of proof. It doesn't change. It still has, the prosecutor still has to prove that consent was not given, but it's not as victim blaming, because it's not saying that the victim, why didn't you do this? Why didn't you say no? Because so many times when people are being attacked sexually, the trauma is to have tonic immobility, which is where they just freeze. And so for some people, they think that maybe that's, you didn't say no, you didn't say yes, you didn't say anything, so you're consenting. And but in fact, it's a trauma response, and this helps. This would bring Connecticut up to sort of where we are medically in thinking about these things. So and so those are our sort of our major things. There are 4 big major things. So it's a short session. We sure will be quick. We're glad to have some great partners and working on all of this, and I'm happy to answer any questions as well. Thank you.
Thank you so much, Lucy, for that presentation. I do want to remind everyone who's on the call that there is a handout section where you can find the public policy priorities for both coalitions in the handout section, so you can upload them and have them for your reference throughout the whole legislative session. So I don't see any specific questions that are being posted in the comments section. So just everyone on the call know that both Megan and Liza from the CCADV and Lucy and Beth Hamilton from the Alliance are always available to answer questions as they come up throughout the session, as am I and Deb from the Center for our local legislators. We are grateful that you all joined us this morning to learn more about these priorities, and we look forward to working with many of you over the next few months to bring these important issues to fruition. Deb, would you like to say any final words before we close out this morning?
Sure. I'm always that person that likes to be the last word many times. First of all, thank you, Angela, for coordinating our legislative breakfast again this year. It's so critically important, as we are so very proud to be part of both state coalitions, being a dual agency, as well as being a children's advocacy center. What does that mean? You've read about it, you've heard about it. If you haven't, for those of you who are listening or who will be hearing this recording later on, the things you hear in the media about the spike in abuse that has happened due to the pandemic has had a significant impact on all of our communities, not just here in Connecticut, across the country. And when we look at the spike in numbers of individuals we are serving, it really is an enormous amount of people that need our help. But I'd like to focus the spotlight right now on a lot of the work that you just heard from Megan, as well as Lucy and Beth, who is our CEO on our Sexual Violence Alliance here in Connecticut as well. We talk about children. At the Center for Family Justice, it was critically important to us 6 years ago when the opportunity came to start a national program, the only trauma-informed program called Camp Hope America. We started this program as we were cutting the ribbon on the state's first Family Justice Center to include resources and services under one roof for victims of abuse, a model identified by the Department of Justice as best practices on serving victims. And I remember 14 and a half years ago, we did a very, very thorough deep dive on what we should be doing in Bridgeport to add resources. And we started with exactly where we needed to be. Those that we were serving, our constituents, victims of abuse, tell us what we're not doing for you and what we can be doing for you. And the process began as we added so many different aspects in our agency. So when a client comes through the doors, we are having as much possible help and support for that victim, not only during the crisis, but after the crisis, helping them get back on their feet, giving them continuous support. But their children that come along with them, in addition to themselves, needed coordinated support. And bringing Camp Hope America and measuring the hope and the resilience that our kids that have now had 5 full years of year-long support, not just summer camp, but year-long support by our unit has really had a very positive impact. The 92% of the 170 kids in the city of Bridgeport that we've served and our surrounding towns have really thrived, so that we look at them moving into a very positive outlook of former victims of sexual violence, physical, verbal, and emotional abuse from domestic violence households. They truly are the future of breaking the intergenerational cycle of abuse when you cross over on sexual violence as well as domestic violence. So it's critically important having our child advocates at each one of our member agencies in our state to continue to move forward on this. Financial support, it's a great idea as long as we can sustain it. There's nothing worse than bringing programs and support services in and then they're lost. So my words of encouragement and support are to those that can make a difference when they can vote on moving our coalitions forward, on the financial support we need, so we can support the spike in clients that we're seeing related to sexual violence on our college campuses, children that come with our clients through our doors at 753 Fairfield Avenue, those that call our hotlines related to both issues. Our 18 member agencies in Connecticut that are part of the Connecticut Coalition Against Domestic Violence, and the 9 agencies that are member agencies of the Connecticut Alliance Against Sexual Violence. Your support is greatly needed. And I know here in Connecticut, we have great advocacy. We need it now more than ever. And that may get old to so many of you that hear that, but truly, as we've all been very, very exhausted and tired through this 2-year pandemic that we all thought would only last maybe 2 months. And here we are. Here we are today. So please know those that have reached out and been getting the free confidential support from both of our coalitions now need the legislative agenda that was so beautifully articulated this morning by both of our state coalitions. We appreciate it. We appreciate questions. We appreciate involvement, engagement. Please, whether you're in the greater Bridgeport area, you're any part of the state, or with the platform we have this morning, and folks that may be looking at this from other parts of our country. One thing we've learned as a Family Justice Center through our prevention education work is people are taking educational platforms from anywhere they can. I guess an outcome from the pandemic is you can put the word out, and people from across the country and actually beyond will learn more about the work that we are doing here in Connecticut, and hopefully they can bring it to their own hometown and be advocates to help support our legislative agendas here in the country. I want to say a big thank you to everyone that was presenting this morning. Thank you, Megan. Thank you, Lucy. Beth, always thank you to you for your leadership on sexual violence work that we're doing. Thank you, Liza Andrews, for the great work that you do, bringing our entire state together on these important issues. We have an incredibly dedicated, passionate staff here in Connecticut. So those are my closing words. And for all of us that are listening, I know I have members of our board of directors that I will always say never give up, are always there as we are putting out these agendas. They are also bringing that out to their community and their personal groups to help support the work that you heard about this morning, so we can pass some of these laws, make sure we're protecting and getting and gaining the critical important dollars to keep this work moving forward here in the state. Thank you all for joining us this morning. Be safe, be healthy, and please get involved. Thank you.
Thank you. Goodbye, everyone.